The pectoralis minor lies next to the rib cage deep to the pectoralis major. Its fibers run perpendicular to the pectoralis major fibers from the scapula's coracoid process to the upper ribs. The major vessels serving the arm, the brachial plexus, axillary artery, and vein, cross underneath the pectoralis minor, creating the potential for neurovascular compression by this muscle. So let's begin by isolating a few of the key bony landmarks that really point out where the pectoralis minor is located. The first is going to be the coracoid process of the scapula, which I can easily find by locating that lateral portion of the clavicle there, and then just sliding inferior and using my broad finger pads right here. It's sort of like a little fingertip that points out right there. And that's where the pectoralis minor is going to attach and then run diagonally across the chest. And there we can see it just deep to the pectoralis major. Great. So we've got the coracoid process, and then it comes down and attaches to the third, fourth, and fifth ribs. Well, there's a lot of ribs, so how do we know which one's the third, fourth, and fifth? Here's how. I'm going to just locate the top of my partner's sternum right here, that manubrium, and then I'm going to just work my fingers down and about, right there, about an inch, inch and a half down, there's a little speed bump in between the body of the manubrium and the sternum. And if I walk my fingers laterally a little bit, there's a rib right there. Well, right off that sternal notch, that little hump, is going to be the second rib. So if I know that this is the second rib, there's a little gap. That means this is the third rib, and there's a little gap. And there's the fourth rib, and a little gap, and there's the fifth rib. So we've got the fifth, fourth, and third rib right there. And if I just kind of walk my fingers laterally a little bit, I can just imagine that that, again, as we see it, is where the pectoralis minor is going to attach. So now that I have an idea of where the pectoralis minor is located, the question is, how am I going to access it? Well, I could just work right through the pectoralis major fibers here, but the pec major is pretty thick muscle. So instead, I'm going to go in through the side door of the axilla. So for that, I'm just going to passively abduct my partner's arm, and I'm going to locate that lateral edge of the pectoralis major right there. And if I'm not quite sure, go ahead and make a little fist and press it into your hip. Well, there we can really locate that lateral edge. So I'm going to set my thumb just in the axilla beneath that, and there's the surface of the ribs right there. And I'm going to very slowly, with my partner's breath, sink my thumb up into the pathway of where that pectoralis minor is going to be, right in there. And I feel the density of a small muscle that lays right next to the rib cage. And go ahead and just bring your shoulder down toward your hip. Great. And as he does so, a very small contraction, underneath my thumb, I can feel that pectoralis minor engaging. Good. Go ahead and relax. And sure enough, there, that muscle softens. And I can also scoop the elbow and just mobilize the shoulder a little bit to even shorten up some of this axilla and pec major tissue to work my thumb even a little deeper. And I'm working nice and softly and gently right in there. Good. Before I turn my partner sideline, to lengthen the pectoralis minor, I can scoop the shoulder and shrug the shoulder up and sort of round the scapula this way. And to shorten it, I can depress the scapula and bring the shoulder forward like so. So bringing these two attachments closer together, or to lengthen them further apart. So now with my partner sideline, I'm going to just scoop the elbow and bring the arm and the scapula around the thorax like so. And what's great about this is it really opens up the axilla to access part of the pec minor. So I'm going to set my thumb right there along the side of the rib cage and just slowly descend right into that pathway of the pec minor. Nice and soft and slowly. And if I ask my partner, go ahead and try to bring your shoulder down toward your hip so he depresses his scapula. There I can feel the edge of the pectoralis minor right along the rib cage engage. Great, and relax. Good. And so another great way that you can access the pectoralis minor in a sideline position by getting your hands right in there in the axilla.